All right, what's up, everyone? It's Zach, and I'm here with a very special guest. I'm here with Anna Krinke. Anna, how are you tonight?
I am good. How are you?
Good, glad to hear. I am doing well. Thanks for asking, and thanks for taking some time to be on the podcast.
Yeah, thanks for having me.
Of course. So, for those of you listening back home, Anna, a really awesome person, a fellow Chippewa, so fire up, Chips.
Fire up.
Fair up. That's where Anna did her bachelor's, and then after that went to Wayne State, where she has been studying to be a physical therapist. So super cool. Something that I know, not I would say pretty little on, but I kind of vaguely information on it. So I'm very excited to talk to her about that. But through her academic journey, also doing a lot of research and studying different very fascinating things that I'm sure she'll dive into a bit. But yeah, that's a bit about what Anna's up to and what her background is. But do you mind kind of giving the audience a little bit more on who you are, what you're up to, all that good stuff?
Yeah, so I started my higher education at CMU, Fire Up, and I majored in kinesiology, exercise science. Um, from there, I applied to different PT programs and was fortunate enough to get into a few and was able to decide that I wanted to be in Detroit at Wayne State. So I decided to start that program, and I started that in 2020. So it's a doctorate of physical therapy, which is a 3.5 year program. So I am on the tail end of that currently in my third, like the second half of the third year, just in my clinical rotations right now. So I'm all set, all done with my didactic schoolwork, working out in the clinic right now, getting a lot of experience before I will be graduating and a licensed physical therapist. And so I take my boards in October. Hopefully, all goes well. And then I will be practicing in 2024. So I'm very excited. Would you like to know more about what physical therapy entails? I feel like a lot of people think that it's,
Yeah,
massage after you have an injury, things like that, and then you're on your way. And I feel like a
yeah,
lot of people don't really understand it fully.
yeah. I would love to hear more about what PT fully is and kind of all the background and what it entails.
All right. So the broad term would be physical therapy is the field of human movement and specializing in musculoskeletal conditions.
Okay.
So we have a variety of specialties that we are involved in. So we can have different residencies, either specializing or going into a residency following your doctorate program. So that could be anything from sports medicine, orthopedics, oncology, pediatrics, neurology, women's health, and even wound care. We work a lot with wound care. It's more historically been something in the past that's not as common right now, but it's something that people don't know that we do a lot of, like burn units, things like that,
Hmm.
pressure ulcers, wound care, things like that. So there's all those different facets of physical therapy. Um, but really, we're just there for a lot of rehabilitation following disease states, various disease states, and operative procedures.
Okay. Interesting. So I can kind of see why there is that like on what it is, but also like I can now see why there it's like so deeper than what people maybe commonly think it entails.
Oh, yeah. And it's recently in the last, I think, 15 years, was a master's beforehand, and now it's required to be a doctorate. And in Michigan,
Mm,
we have direct access, meaning you don't need a script from your physician in order to come see a physical therapist. So we have to have a very wide scope of understanding of various conditions, not just musculoskeletal, but all total body systems, in order to make sure that everyone would be safe to participate in physical therapy if they have not yet seen their primary care provider or gotten a script first. So we're required to know all of this knowledge in order to keep everybody safe when they are participating in therapy.
that's very interesting. I had no idea of the changes that kind of have happened recently.
So if you ever have an
Hmm.
issue, you can come to us first without even going to your doctor. It kind of takes the middleman out of it.
Yeah. Does that, I guess from like your perspective as a physical therapist, does that make things a little easier then, that you can kind of eliminate the middleman a bit?
I would say yes and no. So it depends on what the problem is, because some um, conditions, for example, a lot of like internal like things that we would need um, further lab tests or diagnostic imaging for to totally know the extent of the injury. We can screen and do certain tests to tell us what's going on, but we will never know like the full extent until we have that imaging or the lab work and things like that, which then they would have to go get from um, some type of physician or something like that. We can do order imaging. We cannot perform imaging, which is a setback and controversial. There's different pros and cons to that, obviously.
Mm-hmm.
But for like your standard low back pain or meniscus partial tear or weakness, general deconditioning, it really helps. And especially a lot of the elderly population, they have to go to so many appointments and
Mm-hmm.
juggle all of these things, and it's very difficult to have that. And then getting rid of that waiting period and scripts and processing of things really does help our patients get rid of their problems quicker. Especially, let's say someone throws their back out, you have to
Mm-hmm.
wait to get into your doctor 3 days, and then you wait until the next week until PT's open to get your script and go to your physical therapist, and by then it's been almost what, a week and a half until you're actually
Right.
seeing that care. So it definitely is very beneficial for patients that need the quicker care, for
Yeah,
sure.
that makes sense. And now, of course, like a physical therapist job is like the job exists because of the knowledge and information to help someone, like you said, if they threw out their back, kind of heal that and get the rehabilitation they need. With a lot of like, I guess, common physical therapy related injuries or ailments, um, is it are those things that if you don't see a physical therapist and kind of get the assistance for it, you're kind of always gonna have lingering issues or pain or struggle with it? Or like, is there somewhere it's like, I guess you could just neglect it and you'll probably feel better eventually, but it's not going to really be a good healing process. Does that make sense?
Yeah, no, that makes sense. And again, I think a lot of the biggest thing we learn in PT school is it depends. So like if I say
Okay.
it depends a lot, it depends. But
Yeah.
a lot of times if we have an injury, things can heal on their own, and over time, yes. Especially like you can gain your strength back, you
Mhm.
can go train in the gym. However, a lot of people don't know the proper ways to dose their exercise. They're either under overdosing and
Mm.
they're not doing it properly, or if you completely just leave it and try to see how it goes, a lot of times our bodies are going to compensate for the functional deficit one area. They're going to overcompensate somewhere else, and then that can cause further injury to another area. And then instead of going to PT and fixing that one problem, it's 10, 15 years later, and now you have two problems because you didn't address the one. And that's a lot of
Mhm.
common things we see with like our older patients, is things that they've left untreated that weren't horrible and that they could live with functionally every day, but then over time it's causing and leading to other problems. So I think it's really important to educate the populace about, hey, there is no pain, no gain isn't always true. You can't
Mhm.
always just work through something. And I feel like we're a society where it's go, 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 no sick days,
Yeah.
no days off. And no, you need to work through the pain. Like your ankle hurts, it's okay. Just walk through it. And that's okay sometimes. But at the same time, we have to be able to take a step back and, listen to our bodies and know when, hey, maybe we need some expert advice and some guidance on
Mhm.
how to do so that we can avoid future problems as we age.
Yeah. Definitely, and I think you brought up something interesting about educating the populace on, things like this. Do you have any ideas or suggestions on how, as a society, we could or maybe should start better educating folks on this kind of stuff?
Yeah. I mean, I think social media is both the best place and the worst place for it. So there's a
Okay.
lot of great information and great outlets and opportunities that healthcare professionals in general have in order to spread this information,
Mhm.
promote it, things like that. But there's also a lot of misinformation that can be spread as well, self diagnosing, things like that. So I feel as I feel like as healthcare professionals, we do have a duty where if we are spreading information, to know what the means are to do so and the correct way to do so and who our audience is and things like that. Um, and I think social media is a really good outlet, especially I'm now new to the TikTok the TikTok world, but
Yeah,
having videos, and that's really really something that like 20 years ago we didn't have. We couldn't
right.
just like give you a 30-second clip of 5 different things that could be really beneficial, and I think that's really cool, and there's some really good accounts out there um, focusing on various different conditions, things like that, that are really awesome. But I feel like one of the messages is that's probably the hardest one to negate is that I feel like exercise, which is basically the way in which we treat. We do manual techniques, but exercise as well is like one of our most important things. And I feel like in America, exercise is such has a negative connotation. You don't exercise because of good things that are happening necessarily. It's you exercise because you're too overweight. You
Hmm.
exercise because you're not strong enough. You exercise because you have to manage a health condition. You have too high of blood sugar, or things like that. And it's seen as something that you have to do to negate something negative, and then it's associated with something negative.
Hmm.
And I feel like that's a problem we have, and even I struggle with myself, is seeing exercise as something we get to do to help our bodies, and it makes us feel better mentally, physically, and just well-rounded overall quality of life. And I think that's a message that should be explored and promoted more. So rather than how can we fix this condition, that's great too, but how can we prevent this from happening? How can we enhance everyone's level of activity in a positive way so that you enjoy it? You don't use it as punishment, but you use it as a reward to your own body. Does that make sense?
That makes a lot of sense, and I really like that because I mean, I think back and I know that you're, into fitness and exercise and I am as well. So like I know that what you said is a mindset that I have myself and I've struggled with, or I didn't even realize kind of that other perspective of like when we do exercise and things like that, it is kind of usually for negative reasons, right? Like you said, we feel like, oh, we just went on vacation and indulged in food all week. So now we
Mm-hmm.
have to go to the gym to burn it off, or I'm 2 weeks, I need to go build muscle, whatever the case may be. But I think like having that perspective of like you get to work out and like it's it's good for your body, or it's good for your overall health, mental health, physical health. I think that that's such a important kind of shift that we can all make, because it's like the when you were talking about it, it almost to me felt like I even or we all view exercise almost like a punishment, to like
Yeah.
we have to punish ourselves and do it, and that takes the joy out of it, and that just makes it more of a chore than like, yes, I get to do this, and I see all the benefits that it has on my life.
Oh, yeah. And I think it's not our fault that we think that. I feel like the media and society kind of push that message like
Mhm.
its negative connotation, and like even things like, oh, this weight loss pill, you don't have to go through grueling hours of activity at the gym, just take this pill, therefore indicating that going to the gym is a bad negative experience when it doesn't
Yeah.
have to be.
Yeah. Totally, and yeah, I know that kind of in the time we're in right now, there's been a lot of stuff over the last few months about like just various, prescriptions or drugs that you can take that aren't
Yes.
for weight loss per se, but like that's a side effect. So it's getting a little crazy.
Yes, and I know what you're referring to. I don't know much about that. I haven't
Yeah.
really looked into that topic before, but yes, I've heard of that as well,
Yeah.
and that's not what it should be.
Right. Right. And I think like, as we're talking about just exercise in general, I think going with the negative connotation that there is, a lot of people think like you have to, go run 20 miles and bench press 500 pounds to like
Hmm.
be considered like, you know, getting good fitness in, or like being physically active. But really like exercise is just it's movement. So I mean just like going for a walk every night after dinner, or finding a dance class that you like to do, or something like that, that is perfectly great ways to exercise, and it doesn't have to be this huge like intense, you know loud dropping weights on the ground type exercise for you to get good, physical
Right.
fitness in.
Exactly. That's exactly right.
Yeah. And I'm assuming that kind of like with the different age groups that physical therapists work with, whether it's, maybe close to our age, maybe it's teenagers, maybe it's, middle age or elderly population, there's going to be different ways that, you're going to want to kind of look to exercise to be a preventative measure.
Yes. So it definitely changes based on one, the person's current baseline level. So we always ask, what's your current level?
Hmm.
And some people lie, they don't want to sound bad, but we
Right.
can also tell based on their strength and their endurance and their response to exercise. But definitely, the sad thing is I have noticed that with some of my teenage patients, some of them are having some strength and posture that I'm seeing in like my 40, 50, 60-year olds.
Mm,
And even like during sessions, I'm not generalizing to this all of teenage population.
sure.
Just a few things I've noticed is like with the phones, our posture's horrible.
Yeah.
And even during therapy, some of them will be glued to their phones and not being as present. And it's really sad. So I think so back to the social media thing, I think it's a great place for education and to spread awareness of different things, but also um, has some negative effects on our health, our
Right.
posture, our cervical muscles, especially things like that. But as far as like my exercise prescription for different age, it's definitely based on their baseline. And I can tell you, I have some 82-year-olds I've seen that have the strength of a 45-year-old, and they'll get the same
Wow.
program. It's just
Yeah.
dependent on them specifically. But it's definitely, you can tell who exercised throughout their life and who took care of themselves versus a patient that did not. And their quality of life in their elderly years is drastically different. And it's just something we can do every day, implement into your life, and it'll make your later years much better. And I think that's something we miss, with medicine and things
Yeah.
like that. There's medicine to manage conditions, but movement is one of the easiest. It's the cheapest, most
Hmm.
readily available to you. You always have your body handy, and you don't have to pay anything to go for a walk. So
Right.
yeah.
Yeah. And I can't remember what the exact kind of saying, or not saying, but like what we're told we should do as kids, or what, maybe 10 years ago was kind of common mainstream. But there it was something like, do, I don't know, like 60 minutes of physical activity 4 days a week or something along those lines, or cardio or something like that. Do you all have like recommendations that you would give to like the general everyday public individuals about like how much activity or exercise they should be getting on a regular basis?
Yeah, so the guidelines currently are you want to get 150 minutes in of moderate intensity exercise a week.
Okay.
So that they recommend like 5 days of 30-minute bouts at a time,
Okay.
in addition to minimum 2 days, including resistance training.
Okay.
So if you look at the stats, I think it's less than 30%. I want to say, don't quote me on that, but get in the actual minutes, 150 minutes. But then when you add in the resistance training, I think that number like halves.
Mm,
So it's very low percent of people that are getting that in.
yeah.
And I think children, it's more play like physical activity that we want to see, especially like building social relationships, things like that through physical activity.
Yeah.
And they obviously, like, I think about an hour of play like activity is really good for kids, but adults, it's like that 30 minutes, 5 days a week of moderate intensity. So but the resistance training is something that is very much so missed.
So, and just to clarify, so is the resistance training twice a week minimum? Can that be combined with the 30 minutes 5 days a week, or would those be separate? Or are those separate?
Yes, it can be combined. Yeah. So they
Okay.
want
Okay.
2 of those days to involve some type of
Okay.
resistance training of the five.
Got it.
That
Okay.
makes sense.
Yes, perfect. And then
Thanks for
for
clarifying that. Yeah.
no, yeah, of course. And then for the, I guess all the 5 days when it's the moderate intensity workout, like what would that kind of look like? What would that kind of intensity look like?
So that would be either based on like your repetition maximum, which is individualized,
Hmm.
or your heart rate. So it's about
Okay.
like 65% of your heart rate max.
Okay.
So for an average person, it'd be like, let's say 120 to 150 heart rate. You got to get your heart rate up in order for that to be like a moderate intensity.
Okay. That's good to know because then like I was thinking about that and I was like, like what would I do that would be considered
Yes.
like moderate intensity and like that helps knowing that like we've talked about like walking is a good form of exercise, but maybe that's not quite, intense that has the moderate intensity that I need that I should be looking for. Like it's still great to walk and I should still definitely do that to warm up or cool down or just for fun, but also maybe do some biking or swimming or something that's going to raise that heart rate a little bit more.
Yeah. A brisk walk, add in,
Yeah.
or a lot of we high intensity training is wonderful and
Yep.
quicker people for people who don't have enough time.
Right.
But from even if like you walk, so let's say you don't get into that 65-80% of your heart rate max,
Hmm.
even if someone is sedentary and then they go from being sedentary, completely sedentary, to adding in 30 minutes a day of walking, that will decrease their risk for any type of heart related problems drastically. So even if my patients are like, oh, no way, I can't, I'm not working out like that, I would rather them go for a nice slow walk than do
Yeah.
nothing. You know, anything is better than nothing.
It's crazy to like kind of hear that and think about that though, that like even just going on a very like slow, calm walk, like how much that can have an impact on our physical and well mental too, but just our lives in general, like how much that can impact our health. And it's like it's not anything that needs to be scary or that's usually that difficult, but just little things like that can make such a big difference.
Yep. Yep. Exactly.
So another thing that you talked about recent or just, 10 minutes ago or something was about posture and how that's something that you're kind of maybe seeing in a younger age demographic of teenagers and such. And I think like I even think about myself and I'm like, my posture is probably terrible. Just like kind of like you're saying from like phones and, working at computers and stuff like that. So is it kind of seeming that nowadays like posture has been declining for adults?
Oh, yeah. Oh,
Okay.
yeah. And I would say the people I see, probably at least 90% of them could benefit from some type of rehabilitation involving their posture and posture correction.
Hmm.
It's crazy. I mean, I myself have horrible posture. Going through grad school and college on a laptop
Yeah.
promotes posture, sitting for hours at a desk um, on your phone, and it's something that's really hard because you can't constantly be thinking about, all right, is my posture right? Is my posture right? All day. That's not
Right.
something that it's not feasible for people to just have that all the time. So
Right.
sometimes I'll have people set an alarm on their phone or like put a little dot on their hand, and every time they see it or see a sticky note on their desk that says posture, it'll just remind them, all right, sit on up, work on that posture, do some of the stretches for your back that I've taught you. Um, but it's really, really difficult to get someone to stop doing that because you can't tell someone to stop using their phone or stop using their computer. You can only alter the way that they're using them to make it
Right.
better ergonomically for them.
Yeah. No, that makes sense. And I think like again, like I'll put myself out there on blast a little bit, but I think like you said, my posture suffers from being on a laptop and being in undergrad and grad school using that and just my phone. But then I think even like I'll notice sometimes if I'm like standing in line for something, like I'm like, wow, my posture kind of like sucks right now. Like I'm all like hunched over or, I just, don't I guess like have like a straight back, whether I'm sitting, standing, whatever it might be. So I think it's like one of those things where it's like we all kind of, at least I feel we all have very poor posture. We just don't always realize it until maybe it's like too late to the point where you're like experiencing discomfort or pain because
Yeah.
of prolonged. poor posture.
Yeah. And a lot of people have severe issues with, they call it radicular symptoms, which is nerve related pain,
Okay.
which can be caused partially by some poor postural
Mm,
mechanics. Um, excuse me. But I think there's no one out there that has perfect posture.
sure.
And I think even if we had no phones, no computers, no one would have perfect posture, but it's definitely something I think everybody could benefit from.
Hmm.
And you don't need to go to physical therapy necessarily because you think you need to alter your posture unless you're having a lot of problems, a lot of tightness, things like that. But there's a lot of things online that have good stretches, good educational videos, even just reminding yourself throughout the day and putting a reminder on your phone or on your desk somewhere. Just work
Hmm.
on that so it doesn't become an issue later on.
Right. Right. And whether it's like you know about this because of research or just being a physical therapist or your own maybe kind of personal take on it, but like, do you see a lot of like benefits to things like standing desks or kind of like these newer things that people are trying to like incorporate in like workspaces? Like, do those have like postural benefits, or is it kind of just like maybe a little bit, but not necessarily like gonna make a huge difference?
They definitely help.
Okay.
I had a standing desk during the beginning of grad school and I loved it. I like that the ones that you can alter the position so you can go from
Mm-hmm.
seated to standing. Because being static in one position, no matter what the position is not good. Our bodies need to move. Our bodies need to adjust throughout the day. We're not vampires. We're not stone. We aren't rigid. We're not supposed to
Right.
be rigid. We're supposed to be dynamic. And
Yeah.
so all even just like if you sit for some period of the day and you stand up for a bit and then you sit and then you go take a walk around the block, things like that, that can really help. Also just even having laptop stands. I have my laptop on a little stand so it's actually at my eye level so I'm not
Mm.
looking down at it. That can really help. And I know a couple of people who have phone stands.
Yeah.
I don't know. I've never tried that, but I've heard that that's also very helpful. So I would say anything you can do is to alter your position throughout the day and take breaks and move around.
Yeah.
That's a big one.
Yeah. I think that makes a lot of sense. Like, I try to um I try to like get up and walk around at least like for a few minutes every hour. And I know that maybe some people listening to this might be like, yeah, that's not really because I,
Yeah.
have X job or Y job. But I think like if you're kind of like in an office setting or, work from home and you just, sit at a desk or at a table and work, like if you can just like take a few minutes to just walk around, or if like you have to make like phone calls for your job, if you can like maybe take a couple calls like and pace around or walk around, like I found that
Yeah.
that's been just like helpful a lot for me.
That's awesome. Good for you. Yeah, no,
Yeah.
that's definitely helpful. And the pacing thing, everyone's like, "Oh, I hate a pacer." I'm like, "Hey, if you need to pace when you're on the phone, go for it. You're moving."
Yeah, exactly. It's like, and it might be like you might feel like it's like, oh, what is pacing on like a 10-minute phone call going to do? But I feel like, if you do that a few times a day and then, do that a few times a week, it adds up and it's all movement, it's all exercise, and it's not like you're running a marathon, but you're still getting your body moving. And again, like that's what our bodies are meant to do.
Exactly. Exactly. Get those steps in.
Exactly.
Every bit counts.
So I am curious because you brought up the steps thing. Do you think like I've read a lot just over the last couple of years about like how 10,000 steps should be the minimum, but then I read like 10,000 steps is kind of like a weird arbitrary thing that just is kind of like a made up number. Like, should we have like a daily step goal, or is it just like be be active, get moving, and just whatever like you can do is fine?
I so I think it depends. It depends on the person. So if
Sure.
your form of exercise is going to be your walking, then this goal for a step is wonderful. But if your form of exercise that you choose that you enjoy is, let's say, lifting,
Hmm.
then my watch isn't going to pick up that similarly to how walking
Right.
would be picked up and my steps are going to be less. Does it mean I'm less physically active? Does it mean I'm not working on my cardiovascular endurance to some extent, working on my strength? No, it doesn't. So I feel like it depends on the person. But
Okay.
if you are just going throughout your day and you're not working out, I think step goals is a really good way to make sure that you're moving and continuing to get in some exercise if you cannot dedicate certain time to whatever exercise you choose to do. So like for me, if I have like a 10-hour day at the clinic, I know my steps are going to be lower because, believe it or not, physical therapy, we stand and work on people. So we don't get a lot of steps in. We're
Mm,
moving, but we're not, we're not walking around.
right.
We're just standing there actively using our bodies for treatments. But I will make sure that I go home and I use steps as my goal. Or if I decide, hey, I'm not going to work out today on walking, I'm going to work out today with my HIIT workout, then I will allow myself not to hit my step goal because I at least did this. So I
Right.
think it depends on what you do during the day. But as far as the number of 10,000, I don't really know much about. Yeah, like I know that's like the daily goal and
Hmm.
recommendation, but I don't really know the origins of that
Yeah.
number and who came up with that number and the research behind it. And I'm sure there is some. So that's something I will definitely be looking into. So thanks for bringing that up.
Yeah. So, okay, like maybe this is a bit of a rant. So to anyone
You're
listening, bear
fine.
with me for a minute. But so there's this like person I like to watch a lot of YouTube or listen to YouTube when I'm like cooking or just like doing like walking or whatever. So like I just have something going on in the background. And I listened to a video like maybe a couple months ago, and they said something along the lines that like the 10,000 number comes from it comes from Japan. They had like pedometers that they kind of like I don't know like what year, probably, like 30, 40 some years ago or whatever, but they mandated that like all citizens like had a pedometer, or maybe that was they didn't mandate it, but like it was highly encouraged that everyone did.
Mm-hmm.
And like the maximum that it could count was 10,000, and then it would go back to zero. So because
Oh.
of that, like everyone's like, oh, it's 10,000. Like that's what they said the origin was. Like, please fact check this yourself and look into it. To anyone hearing this, and don't take this as word, because it's just what I heard on a video. But I think they said that they like researched it a little bit and that's what they discovered. So who knows? Maybe that's the origin, maybe it's not. But
Okay.
I thought that was kind of interesting.
Yeah. I'm sure there's something that created that number,
Sure. Oh yeah,
but
I'm
also it's a
sure.
nice, easy whole number to
Yeah,
remember.
exactly.
Got like
Exactly.
9,712. You need
Oh,
that.
that'd be
That
wild.
would be hard for people to remember. But
Just a little bit.
I will never discourage someone from getting 10,000 steps
Yes, definitely.
unless there's a reason they have something going on where they should not be bearing weight all the time. But I will never
Okay.
discourage that number.
Yes. Very, very true. So I don't know if this is kind of branching out of the realm of things that would be kind of related to physical therapy. So if it's something that has like zero relevance, just let me know. But
Okay.
um it's body related. So I think like you might have a little insight on it. Cracking things like your neck, knuckles, back. Is
Mm-hmm.
that like I've heard it's like terrible for you and it could cause problems, and I've also heard like it's really not that big a deal. It doesn't really matter. Like, do you know anything on that?
Yes. So we call them manipulations in physical therapy. It's
Okay.
when you manipulate a joint. So you're actively moving the joint in one direction or another, basically,
Yeah.
in a quick, forceful manner with a high
Yes.
velocity. Um, and that noise that you get, that popping, is just air. People
Okay.
might think that, oh, you're actually changing where this is in time. And I guess to an extent, if you have certain mobility things going on, you could be changing where, but it's mostly just movement of the joint, the air between the joint as you are changing that direction of the joint. So, I mean, we have been taught that it's like cracking your knuckles. It's really not going to do anything.
Okay.
Uh, I crack my knuckles all the time. It's like my nervous habit.
Yeah.
Um, yeah, it's not really something that we delve so deep into. A lot of chiropractic work does a lot more manipulations than we do.
Mm-hmm.
That's something that's like we do it, but it's not as commonly done in physical therapy. But
Right.
yeah, cracking your knuckles, that's fine.
Okay.
A lot of people crack their necks, and a lot of people find relief from whatever soreness or aches or things they have. And I say, well, if it's not making you feel pain and it's not making you feel worse and you feel relief for it, I'm not going to tell you not to do it, because
Yes.
I'd rather you feel better and feel easier to move around, feel looser than the alternative and then not move. So I personally don't think it's a horrible thing, cracking your
Okay.
knuckles.
Yeah, that makes sense. That I'm the same way. Like, whether it's like a nervous habit, knuckles, or just like if I've been sitting all day, I'll like to like twist in like a chair and crack my back or back. I feel a little better knowing that I'm not potentially causing major damage to myself.
No, no, you're not like ruining the
Yes,
cartilage on your bones or anything.
that's good. Good.
It
I
would
would
take a
be
little more than that.
yes. Yeah. Okay. Cool. I'm in the clear.
Yes. That's a good question.
Yes. So thank you. So, one thing that I kind of want to pivot to a little bit to chat with you on is research. So I know that research is pretty
Yes.
big with going to grad school and all your studies and everything. So if you're able to, like, is there any research that you're currently working on or stuff that you've wrapped up or just anything that you think has been really fascinating that you'd like to talk about and kind of share with the audience a bit?
Yes. So, as in my program, we all are given a research project to work in a group with a faculty mentor.
Okay.
And so mine this year was really a continuation of last year's, another group last year. And we were looking at the effects of our new step transit device. So that is a recumbent stepping device, kind of like if you go to the gym and you go to a stepper, but the one where it has back support,
Okay.
and you're seated. It looks like that, but it's way more fancy and high tech than that. So it's called the New Step Transit, and basically, we were looking at its effects on training stroke patients that
Okay.
had hemiparesis, which means basically half of your body, so either your right or your left side, is going to be hemiparetic or weak compared to your left as a result of the stroke that you had. So when you have a stroke, if you have your left side of your brain is impacted by the stroke, your right side will be the paretic side.
Right.
Vice versa, if you have a stroke on your right side, your left side will be the paretic side. So we were looking at the effects of training the ankle specifically on ankle strength, motion, as well as looking at visual tracking and reaction time. So basically, what happens is this is a recumbent stepper, but on the screen, it's like a paddle ball game. So
Okay.
basically, your goal is to track the ball with a paddle that is controlled by your ankle. And there's force plates on the foot so that it can control and pick up when you move your foot down, like hitting a gas pedal, or bringing it
Mm-hmm.
up, like flexing your toes up towards the ceiling. And that controls the motion of the paddle. So basically, we had our stroke patients come in for 8 different sessions, and they were training on that for 45 minutes. And they were allowed any breaks they wanted, anything like that. But most of the time, they just wanted to plow through.
Mm-hmm.
Excuse me. So basically, we tracked how many times they could get the paddle and how, like, their streak for hitting the ball. So every time they hit the ball in a row, it would keep going and keep going until they didn't have control anymore. And then your
Mm-hmm.
score would drop back to 0. So this was really fun because I got to work with the patients, and I would measure all their strength, their motion, their gait, all their visual tracking. I got to do their baseline, take them through all the training, and then I got to see at the end and reevaluate them and see how much they had changed.
Mm-hmm.
So basically, our findings were that the self-selected gait speed of these patients went from an average of 0.8 meters per second to 0.98.
Mm.
And for reference, 1 meter per second is what we consider to be a safe community ambulator. So if you have something under 1, then you're probably at risk for falls, you're not as coordinated, or you have an ataxic gait, you're slower, things like that. So you're not as safe in the community, and
Right.
that wouldn't be, then a physical therapist wouldn't feel safe clearing you for community ambulation. So basically, our stroke patients went from the 0.8 to almost that community ambulator
Right.
which was really awesome to see. And we only did this for 8 sessions. And so that was a short period of time. So if we had them for a full session in physical therapy, we could get them above that community ambulator mark. So that was really cool
Right.
to see for stroke rehabilitation. And we also saw that they had an increase in visual scanning capacity and reaction time, which would be a really good tool to use when rehabilitating stroke patients with driver's training and things like that,
Mhm.
because that's a big issue also post stroke, is being safe to drive a vehicle again. And because the reaction time is delayed, their processing, the neurological processing is different, and it can make it dangerous out on the road. So if we can
Right.
also work that in with driver's training, that would be really, really awesome. So we're working on analyzing more data. That's kind of just our initial findings so far. We're still analyzing other aspects and things we were looking at.
Mhm.
Um, but that was like our two biggest findings thus far. And we're really excited about that. And we'll be, as we do more, I'll let you know when we have everything done and
Yeah.
published. And we'll be presenting in the fall at our PT conference, the APTA Michigan conference. And then after that, I can send you some more info on that.
Yeah. Please do. That's so cool to hear about, and it's to me, it's just really interesting to hear that, like, through kind of like this one, um, like sessions that you're putting, or like the multiple sessions of doing the ankle training, that it really had benefits across the board, right? Like you said, like right now you have like the two big results that came out of it, but it's like they're to me they're like different, right? You're like mobility is one, and then your action or your visual tracking is another thing that I wouldn't have necessarily thought were like related
Connected.
in any
Yeah.
yeah. So like hearing that, and now like you said, you're still synthesizing all the data and the research. It's kind of like, well, maybe there's going to be other things that come out of this positively, and it's like, wow, who would have thought that like you could do one thing and it's going to have all these different benefits on an individual, especially, well, specifically a stroke recovering patient.
Yeah. Yeah, and all they were doing was sitting there moving their ankle. And
Yeah.
so it's just the beginning. And so it's a really cool device, and obviously it's newer, and I
Hmm.
don't think it's not super common, but that would be the goal, is of this
Yeah.
research, people see the value in having devices like this in hospitals, rehabilitation centers, nursing homes, things like that.
Right.
Would be the goal, and to show insurance companies, hey, this is really going to benefit in the long run because of X, Y, and Z. So
Right.
that is the goal one day.
Yeah. I think that's an amazing goal. And I guess I am curious. So like kind of like that similar principle, like I'm assuming there's probably a lot of other maybe devices or other things that people can do within physical therapy, that it's like, you're doing something with the ankle and then it's impacting your mobility and your visual tracking. Like I guess what I'm getting at is like, it sounds like things can be a lot more connected than maybe we realize if we're not in the profession ourselves.
Yes.
Okay.
And so we are very heavily trained on neurological conditions and neurological processes, motor control, things like that.
Yeah.
And because more than anything, your brain is what helps ensure that you are going to be safe with your movement, whether it be your balance, your motor planning, how you react to things. So like changing how your ankle is controlled based on if you're stepping on a curb or if you're stepping on ground or flat grass, sand, things like that. And everything is so fragile as far as when you get injured or have a stroke, traumatic brain injury, all of those things can
Hmm.
be impacted, and people don't really realize how tedious it is to rehabilitate those things and get them back, because nerves, one of the connectors in the brain, they do grow back and they can regenerate, but they do so slowly.
Hmm.
And that's one thing that physical therapy can really help and augment, is that process. And we have to be able to think about, so like our boards, we have to be able to know if you have a lesion in this area of the brain, how is that patient going to physically present? It's not about oh, they have a lesion in their brain. This is the diagnosis. It's more so, how am I going to
Hmm.
see it? How are they going to move? What are they going to have a difficult time doing at home? And that's something we all have to think about as physical therapists when we're um, training and working with the population, especially if you are in a hospital setting or in a neuro setting. And most people don't know that we have to do that.
Yeah.
So it's a very broad spectrum of things that we are.
It sounds like it. It sounds like there's a lot, like kind of like you kind of started the whole conversation with. There's a lot more that goes into PT than is maybe portrayed in media or social media even, or just even like kind of our perceptions of what it actually entails. It sounds so much more broad and it encompasses so much for like our overall health and well-being.
Yes. Yeah. Because there's so much that goes into that
Hmm.
well-being, right? Um, but thankfully we have the opportunity as PTs to decide which realm of that we would like to go into.
Right.
So once I am graduated, I have the opportunity to be like, nope, I'm not a big fan of working with this population. I would prefer this. And we have the freedom and the opportunity to choose that, which I think is really awesome thing about the profession too.
That is really cool. I mean, I think it can make a big difference on whether you're doing something that you're really passionate about and interested in, or if you're just doing something that you're like, yeah, it's all right, but I'm not really kind of enjoying this kind of population of work that could just really make it a tough and maybe fulfilling of a career for some.
Yes, exactly. And thankfully though, if you don't like that population, you can always go back.
Yeah,
So I'm very fortunate enough to be in this field and enjoying it so far being out in the clinic.
good, good. I'm very happy to hear that, and it sounds like through your studies and through your research and the clinics that you've been doing, things have been going really well. And I'm excited for you as you continue on this path and you wrap up all your clinicals and then off to boards, and then when you can actually practice, once you're licensed and everything. I think it's an exciting journey, and I'm excited to see where it takes you.
Thank you. And I hope I never have to see you in the clinic. I hope you don't ever have any problems. I know you have I gave you some info before on
Yeah.
some stuff, but that is my
Yes.
hope for you is that you don't
I
have to be
appreciate
in
that.
physical therapy,
Yes,
that you
I
stay
appreciate
active.
that.
Yes.
Yes. But hey, that's actually a really perfect segue because the last thing that I wanted to ask you was like we talked about exercise and how important that can be for everyone. But to anyone that's like listening, is there anything else other than just getting moving and being a little more active that we could do in our everyday lives that might help us to prevent having to see it in the clinic someday?
Yes. Take care of your mental health, and that goes with the motion, the movement, the exercise. But a lot of times we can have a lot of patients that come in with chronic pain disorders, um, deconditioning due to inactivity due to mental health. So if anything, I would say take care of your mental health, and you can do so by finding the physical activity that brings you a sense of joy. It could be so many different things. And if you try something and you don't like it, don't make that think, oh, physical activity is not for me. It just means that activity is not for you. And you get the chance and the opportunity, which is so exciting, to go and find something else that could be great for you. And so just making sure that in your busy lives, make sure to take a step back and be like, am I taking care of myself wholly? And I think that's a struggle with everybody. And everybody can say
Hmm.
that they have somewhere in their life that they need to give more to, whether it be physical or mental. And I think by adding in that activity that you enjoy, it can kind of kill two birds with one stone. So that would be
Yeah.
my biggest one.
I love that. And, to anyone listening, use this conversation right now as a moment for you to kind of step back and reflect and think about just kind of do like a wellness check on yourself. How's your mental health? How's your physical health? Is there something that you could do to maybe improve both of them? Have you been active today? Is there something that you can do activity wise that you enjoy? Or do you maybe need to find something? And like Anna was saying, there's so many different options out there, and just don't get discouraged if the first thing you try doesn't resonate with you, or maybe you try something for a couple weeks and it doesn't, that's totally okay. That's just an exciting moment because then you get to find something that will get you excited and that you will love. So just keep looking because there's something for everyone.
Yes.
Awesome. Well, as we're wrapping things up and everything, I know you said that as more of the research comes out and everything, you'll get in contact with me, and then I would love to check it out on my own. But then also I can kind of like direct people on where they can check that out as well. So if you're listening along and you found the research interesting, in the future, we'll probably add it to like the description of the episode where it can be checked out and everything. But is there anything else or anywhere else that people should know about to check out? Anything that you're working on or just connect with you or anything like that?
No, I would just say make sure that you're always checking in with yourself. And if you feel like something's not right with your body physically, go to your physical therapist, go to your primary care. They're great resources and they can lead you in whatever direction. Um, yeah.
Perfect. Awesome. Well, Anna, thank you again so much for your time and for joining the podcast. It was great to learn a lot about physical therapy that I had no idea about, and to kind of see what I can do in my everyday life to again, hopefully not have to see you. I'd love to see you outside of the workplace, but
Yes.
I don't want to go to your clinic someday. I'd like to stay out of that.
Perfect.
Yes.
Deal.
But no, it's been great, and I'm just so excited, and it's just so cool to see, from when we were just super young kids at CMU to, what we're both doing now, and what you're accomplishing certainly is a huge accomplishment. And I'm excited. Best of luck wrapping everything's up in the boards, and keep me updated on the journey and everything.
Thank you. Thanks for having me.
Of course, you're very welcome. I'll talk to you later.
All right. Goodbye.
All right, bye.